Today, the Redlands Regional Jobs Committee have hosted what's called an In-Industry and TAFE Day, focused on the health sector and the career paths and the training pathways that are available as one of our key growth sectors in the Redlands and also in Queensland.
We are in need in Queensland, and there is a health crisis always, and we need people filling those jobs. And this is actually opening up the doors where students don't have to go in and do that big degree straight away, but they can learn to taste test, find out where those career paths are, finding out how they can get there, and to actually take them out to the hospital as well and see some real life things happening. They can ask questions and engage.
Health is one of the biggest growing industries, not only in Australia but also across the world. There are so many pathways into the health sector, all the way from administration roles through to dental roles, through to pharmacy, community health, mental health support, disability support. I mean, there are just enormous amounts of opportunity. Student experiential learning opportunities like today are super important for students. A lot of these students have never stepped foot into a hospital or an aged care or even a private practice before. So just having that increased awareness of what are the opportunities out there, and for them to get tours through the hospital setting, that is an incredible opportunity to be able to get some exposure to the industry and really learn, well, what is working in health all about? And is this right for me as well?
One of my Year 12s has spoken to me and said that they hadn't even considered TAFE as a post-school option, that they'd always looked at the university, but to see the facilities here and that it equates to what they see at universities, and to see that they could start a diploma and then move into a degree still staying at TAFE without having to move, is actually a great benefit to them.
We've found as much as we can go out to schools and tell students, it's more talking at them sometimes. And I think as parents and as teachers, it's not the same of having that visual impact. This is something where they can actually come and see where they're going to be learning next.
I was quite surprised at the resources that are available for nursing here at the TAFE College at Arix Hills. Basically a mini hospital set up, a nursing station, wards. The other key message that I got out of today that I'm hoping the high school kids got was talk to the people who are in the job, learn from their experience, talk to others who are a bit further down the path of the qualification and learn about their experience.
Today, it's a really good opportunity for the students to actually see different pathways. Some of the students mightn't be able to get an ATAR, but they can go alternate routes. Actually seeing the facilities here shows them that they can actually do certificates, they can do a diploma and then go on to do their bachelor all through TAFE. It just gives the students different opportunities to get to where they want to go.
Redland Hospital is a place that's growing at the moment. We've got construction underway for our stage 1 redevelopment, which is an ICU and another inpatient unit. And I think one of the challenges we're grappling with is the sheer number of staff we need to put on over the next few years. So the opportunity to have young people come through for an industry day to see how a hospital functions, what job opportunities there are, is just really great for us. The opportunity to be able to showcase the pathways into those sorts of roles is really important, because you don't just have to go to uni to get these jobs. You can apply for a cadetship, you can do a traineeship, you can get your grad certificate and work into those roles, or some don't need qualifications at all, so you could start as a casual and work your way into the workforce from there as well.
We're down here at the Redlands Hospital. We've been here with our Redlands Regional Jobs Committee, something that I'm really proud of the work that they've been doing, particularly with our young people. We know that there are huge opportunities in the health sector in terms of career pathways, particularly here in the Redlands. So it's been fantastic to have students here today to see firsthand all of those pathways that exist. Everything from apprenticeships in our maintenance sections through to midwives, our nurses, our allied health professionals, occupational health therapists, our social workers. There are so many different opportunities. Today they've walked away with their horizons broadened on the opportunities that exist in the health industry.
I loved learning about the Bachelor of Nursing that we could go into. I was unaware that was a thing, and honestly I'm very excited for it. The TAFE course, they had an actual replica at the hospital. That was really cool, and I loved watching people and learning about it, especially like seeing it firsthand. It was really helpful.
I'm super keen to go into something health. Paramedicine is the hope probably, but it was just really cool to come today and see all of the different pathways and all of the different courses that you didn't really usually think of. Looking at that and doing the diploma, and they do a bachelor now, so it's like if I don't get the ATAR, I can go to TAFE or I can do something.
I sort of fell into nursing a little bit. I wanted to go off and do medicine, and I decided to start from nursing and work my way up, get some clinical experience before I start working up into that path. And once I started nursing, I just fell in love with it. It's so much more patient, hands-on. You get to be there with them throughout their entire story. And at the end of the day, when they're having a bad day, the nurses are the ones who are there to make sure that they actually can get through what is usually the hardest time of their life. My number one piece of advice would be just to really care. At the end of the day, the job is hard, just like every other job in the world, but you have to have a reason to go. And with nursing, you have to really, really care. You have to care about the people that you work with, the people you look after, and the job that you do. And if you really, really care, you'll be able to go the long distance with it.
We're really liking health actually in school, so it was a great opportunity to see actually what they do here.
Just learning about the different pathways that health can lead you to, and learning what we can take from what we've learned at school and to apply it into a career, turn it into a future. The amount of jobs that there is that you just are unheard of behind the scenes, opening our minds just what else there is.
Yeah, the camaraderie is really good, how everyone says they're friends, so it's really good.
Thinking about our future a little bit more, looking at the certs we can do and starting to prepare for that now. So definitely look into it a lot more after today.
I've been working as an occupational therapist for just over a year. I do both aspects. I do the outpatients, which is in here in hand therapy, and then I also work over in the wards. I do cognitive assessments, discharge planning, and then hands, interventions, splints. At uni, I wasn't too sure. I knew I wanted to do something in healthcare, was thinking physio or psychology, and this was a good mix of kind of both of those things. It does anatomy, but then also does a person-centered psychology approach as well. With OT, you can go into lots of different areas like rehab, acute, and then sort of outpatient like hands. So it's very diverse and no day is the same.
TAFE offered me this opportunity to come to see the Redlands Hospital with the RGC, and it's been really lovely to see all the different jobs here. I've been looking into being a nurse for the last year or two. After seeing the physiotherapy and how helpful they are and how excited they are to be there, it's just really interesting.
I've always been interested in helping people, and I'm still trying to figure out exactly what I want to do. I'm not sure whether it's aged care or nursing or healthcare or anything. Just now in recovery, it's piques my interest a lot.
I actually started when I was 17. My mum worked at QE2 Hospital, and she got me into the food services department back then. There's all different roles within that. So you can do a food service assistant where you can deliver the food to the patients. We also have production, cooking, and there's also management roles as well. It's not just the service side of things, it's actually working with the dietitians on building the menus for the patients, making sure they're nutritious for the patients, and then also working with the speech therapists. So we look at texture modified meals and making sure that they're safe for the patients to eat as well. So that side of things is so much more interesting than just your day-to-day meals like a cafe or a restaurant. I think the best thing about it is that it's something different and you still have that connection with the patient. I love what I do here.
A lot of industries are out there. There's only very limited jobs availability. This one, as a lady had mentioned today who was facilitating it, and said to the students, if you finish this, you're basically walking into a job. The world is your oyster and you'll basically do the course and you will be placed, and it's easy to get work experience because they set that pathway up as well.